Are you struggling with symptoms related to slowing metabolism due to diabetes or other metabolic disorders? Here are some common symptoms. You don't have energy like you used to. You look at kids nowadays and can barely keep up with them anymore. Exercise has become seemingly impossible. No matter what you eat, you seem to be packing on the pounds. Your whole body has begun to ache. Your feet, legs, back, everything. Your memory is starting to fade. Your vision is beginning to blur. And you find yourself frequently having to rush to the bathroom to urinate. Your body just doesn't seem to be working the way that it did when you were younger. Your once fast metabolism seems to have slowed to a crawl. Sound familiar? Let's take a look at what's going on inside your body, one step at a time. When we eat food and digest it, our bodies break it down into glucose, also called sugars. Glucose is used by the cells in our bodies to make energy. Your cells work in conjunction with the pancreas, which makes insulin to do this. Think of your pancreas like a locksmith, insulin like a key, and your cells having a door that opens and closes. When your muscles and organs are hungry, they send signals to the locksmith to create keys to open the locked doors for the glucose to enter. It's important that your locksmith makes keys at the same pace as the signal it is sent, keeping the process synchronized just right, like a heartbeat. But if you have a metabolic disorder or diabetes, the process isn't so smooth. Over time, some of your cell doors can become stuck shut. When this happens, extra signals are sent to your pancreas locksmith to make even more insulin keys to try and unlock the doors. This causes your pancreas to work overtime trying to keep up with all the signals it's receiving. Unfortunately, more insulin causes your cells to lose sensitivity and keep even more doors closed for even longer, causing the glucose to pile up and make your blood sugar rise. The loss of cell sensitivity is clinically referred to as insulin resistance, IR. Eventually, your pancreas overworks itself so hard that it burns itself out trying to unlock the jammed cell doors. Most of the glucose in your bloodstream can no longer get into your closed cells. Not only does this mean your blood sugar will rise, but now your cells cannot convert the glucose into energy for your body. The rhythm of your locksmith, keys, and doors has been thrown off balance, slowing your glucose metabolism to a crawl. So what can you do? When you reach out to your doctors, they do their best to help you manage your symptoms by suggesting diet, exercise, and prescribing medications. Unfortunately, not all doctors are familiar with the right tools to address the root cause of the symptoms you're experiencing. At Restore Metabolics Infusion Centers, we have the solution for treating the root cause in addition to your symptoms. Our teams of medically trained professionals, including doctors, nurse practitioners, and RNs, are here and ready to help you get back on track. We use a multi-patented infusion modality called physiologic insulin resensitization, or PIR, to help repair your body's natural processes. Patients are seated in our comfortable chairs while the physician-directed, individualized modality administers insulin as a hormone instead of as a drug. Restore Metabolics Infusion Centers' personalized individual care plans work to open your cell doors by acting like a master key, opening them all up at the correct time and retraining them to fall back into rhythm. Your body's natural metabolism can be restored to its correct pace. Restore Metabolics patients utilizing our precision treatment program have reported a much better quality of life. Our diabetic patients have experienced improved neuropathy, better blood control sugar, reversed kidney failure with improved function, and wounds healing faster. As a whole, our clients have reported more energy, less difficulty losing weight, better sleep, improved mood, lower blood pressure, and saving money by reducing costly medications. The best part? At Restore Metabolics Infusion Centers, we work with most insurance companies to maximize our patients' benefits and keep treatment costs as low as possible.